right, good morning, everybody. Thank you for joining us for our press briefing with regard to the state's response to the pandemic. As always, we remind people that the virus is still out there in the community, even with the good news we've had with regard to vaccines that are on their way. We do need people to continue to remember to practice all the good methods that we learned all throughout the course of this pandemic, use the tools we've given everybody, follow our rules. So that means that, again, keep that 6 feet of distance between you and other people when you go out in public, that you're washing your hands often for 20 seconds at a time. That actually kills the virus. That you wear a mask when you go to the store. Stay home when you're sick. That's a very important rule. You don't want to risk that you've got coronavirus and are giving it to somebody else. Try to work from home if you can. When you go to the store, shop once a week, only by yourself. Don't take the whole kids. That's going to be especially important as we approach Christmas season. So again, we want to basically remember that this virus spreads from one person to another, and that if you can avoid those three C's of crowded places, confined spaces, close contact, we will slow down the spread of the virus. That's very important. Also, Test Nebraska is out there and available to be able to get tested. In fact, in the last 7 days, our turnaround time on those Test Nebraska results was 27 hours. We want to make sure people have the opportunity to go get tested if you feel like you've been exposed or you have symptoms. That you can find out whether or not you've got it. That's another way to be able to knock down the spread of the virus here. So please consider using testnebraska.com. And then, of course, the steps we're taking is to preserve our hospital capacity. Right now we're looking at 27% hospital bed capacity, 25% capacity for ICUs, and 65% for our ventilator capacity. We have seen our hospitalizations go down over the course of the last 10 days to 2 weeks. But if those hospitalizations go up and we move from the orange phase, which is where we're in right now, into the red phase, we will have additional restrictions. We will have a 10-person rule on indoor gatherings, 25-person rule on outdoor gatherings. Bars will have to go to takeout, delivery, or drive-through. Restaurants will have hours that'll be shortened up. So again, folks, remember that we've got to continue to practice all of our good tools to be able to slow the spread of the virus. 845 is still a high number of people that are in our hospitals with regard to coronavirus. So please take care to slow down the spread of the virus. All right, so today we've got a couple announcements. One is with regard to essential caregivers. Now, our long-term care facilities have been put on a lot of pressure over the course of this pandemic because you've got residents who are older that may have underlying health care conditions, and that puts them at greater risk. Those congregate living spaces we know are also at greater risk. So long-term care facilities have taken a lot of steps to protect the residents. One of those things, for example, is they've limited visitations. We know this is tough on the families, we know it's tough on the residents, but it's meant to be able to make sure that we don't have virus outbreaks in long-term care facilities. One of the things we're taking steps today and we're announcing is to allow long-term care facilities another tool to be able to help the residents, and that's called an essential caregiver. Now, essential caregiver is somebody who may be a family member, a friend, a volunteer that can come in and help the long-term care facility with the residents. It allows the residents to maybe have more interaction with them, and can also be somebody who is going to be an advocate for them or bring up the concerns of residents, somebody who could maybe help them with complex or critical information, somebody who can just assist them with their needs. It's somebody who can be there for that resident. Now, this is something that, again, you have to be trained to do it, right? So you have to, for example, be trained just like the staff on how to properly don and doff your personal protective equipment. So this is not just somebody who just walks in and can be an essential caregiver. There is training that goes along with this, and it's something that long-term care facilities will probably need to phase in over time. They'll have to do it a step at a time. Like I said, these essential caregivers will have to be trained on how to do this. So it's not something that will just be the doors are open to come in. I just want to caution everybody on that this is a program that we're offering, allowing for long-term care facilities, but they're going to have to implement it, and that may take time. So to be able to talk about the Essential Caregiver Program today, we've got Becky Wiesel, who is our Interim Director of Health Licensure and Environmental Health in our Division of Public Health for the Department of Health and Human Services. And so she's going to talk a little bit about what this means and how this program will be implemented. And then we also have Jennifer Cerno from Leading Age, who will talk about what this can mean for long-term care facilities as well. So with that, Becky, I'm going to go call you up and have you talk a little bit about this program.
Thank you, Governor Ricketts. Good morning. Again, my name is Becky Wiesel, and I'm currently serving as the interim deputy director for health licensure and environmental health with the Division of Public Health. And I appreciate the opportunity today to share information with you about this new essential caregiver guidance for long-term care facilities. And the essential caregiver guidance document is intended for nursing homes and assisted living facilities that choose to designate essential caregivers within their facilities. And again, I emphasize choose, because this is not a requirement. This is something that a facility may use if it works in their facility. And as Governor Ricketts mentioned, an essential caregiver is a person who was previously engaged with that resident prior to the pandemic. So it could be a family member. It could be a caregiver who had worked with them prior to the pandemic. But that relationship is very important. And the guidance is important because it does provide family members and these other caregivers who've worked with residents the opportunity to spend more time with that individual. And it provides long-term care facilities an opportunity to supplement the limited staffing that they currently have by using these valuable volunteers. Now, essential caregivers have an important role in providing care for these residents in our long-term care facilities. And it's because of those existing relationships with the residents that essential caregivers are able to observe and communicate important details with the facility staff about a resident's change in condition or behaviors that might not be what they consider normal for that resident. Essential caregivers also provide emotional support to residents, and they honor the personal values and preferences of care for those individuals. But most importantly, essential caregivers help promote the quality of life for residents, and that's what we're all trying to achieve in our facilities throughout the state. So in advance of this program, we want to thank all of the essential caregivers who participate in this program for the significant contribution they will make to the well-being of the residents in those facilities. Just a few examples of some of the guidance that's included in this document. First of all, facilities must establish policies and procedures for how they intend to designate and utilize essential caregivers in their facility. And as the governor mentioned, that will take time, so this isn't something that will happen next week. Another thing that they need to consult with the facilities administrator, perhaps the director of nursing or social services director, or other designated facility staff to help determine what individuals might meet the criteria for being an essential caregiver. And of course, the resident needs to be included in this decision, and they need to be consulted about their wishes for whom to designate as their essential caregiver. Now, the guidance also includes necessary precautions to prevent the spread of COVID, such as essential caregivers would be screened just as employees are screened prior to entering the facility. They would be required to wear appropriate PPE and use frequent hand hygiene, just as we all are doing. And the plan does limit the number, a facility should, in their policies and procedures, limit the number of essential caregivers who can be in a facility at one given time. Now, the essential caregiver guidance for long-term care facilities can be found on the DHHS website, and that is dhhs.ne.gov. And if you click on the link for Learn About COVID-19, the document will then be found under Guidance Documents, and it should be out there as of today. And I would like to thank Jennifer Acerno, who's going to be speaking here shortly. She is the president and CEO of Leading Age Nebraska, and she was instrumental in the development of this document, as well as Heath Bodie and Cindy Cadavy with the Nebraska Healthcare Association. Those two organizations have worked collaboratively with DHHS throughout the pandemic, and we meet regularly with facilities at least twice a week and share guidance and information, and we do our best to answer questions. So I will turn it over to Jennifer. Thank you.
Thank you. As was mentioned, I'm Jennifer Acerno with Leading Age Nebraska. I'm happy to be here today. I want to thank this group for the opportunity to visit some more about this program that DHHS has worked to develop that is a tool in the toolkit that long-term care may utilize in helping to facilitate and mitigate the impacts of COVID-19 on our long-term care residents. We would like to thank, Leading Age Nebraska would like to thank DHHS for the continued collaboration and looking for innovative ways to try and address these issues. Both Leading Age Nebraska and Nebraska Healthcare Association have worked very closely with DHHS to help evaluate efforts and opportunities. The Essential Caregiver Program has been adopted in some other states, including Minnesota, Florida, Indiana, and South Dakota. The Nebraska program is modeled after the Minnesota program. There are some differences with the Nebraska program in that it does not require a facility to register to participate, and there is no set time frame to enter the program. One of the most unfortunate results of this pandemic has been the necessity of the state and federal guidelines that have been put in place to protect residents who are among the most vulnerable to COVID-19. Typically, we would say that we like to engage residents with social activity and we encourage that, but we recognize these times are not typical. Isolation has, however, taken a toll on long-term care residents, physically, mentally, and emotionally. And this program allows for an essential caregiver provider to help maintain resident health across that spectrum. Essential caregivers will help to reduce isolation for long-term care residents, while also, as Becky alluded to, assist those facility staff in doing some of those more routine tasks that those family members or essential caregivers may have already been engaged in doing prior to the pandemic. There is hope that that will free up some of the staff time for long-term care providers, as right now workforce shortages are significant in that area. We would like to express our appreciation that the program is a voluntary program, that it allows providers to assess their specific situation and ability to implement the program if they choose to do so. Providers are keenly aware of and very supportive of trying to do what they can to help residents feel some level of normalcy and engagement at this time, because it has been very difficult. Providers will need to consider things like community spread, access to PPE, staffing availability to help with screening, and a number of other things as they determine whether they will implement this program. Some may be able to implement in the next few weeks, and some may have to hold off. I think it really depends on each facility. So we recognize that providers will need to assess how this program fits within their ability to implement. And I would just like to also caution, as the governor said, that if facilities do decide to implement this program, which again is a great tool, that it will take time to put processes and other things to facilitate that in place. So really appreciate the work that's been done on this, and turning this back over to Governor Ricketts.
Great, thank you very much, Becky and Jennifer, for working together to create this Essential Caregiver Program. Again, we want to caution that this will take time to roll out, that it'll be a choice for the facilities. I think you make a good point about they're going to have to take into consideration their ability to train the essential caregivers and community spread and all that, because we want to continue to protect those residents. But I appreciate the collaboration to be able to get this program up and running, because I think for the facilities that are able to take advantage of it, will be a help to the residents. So Thank you very much. Appreciate it. All right. So next, just want to talk a little bit about the quarantine change that the Department of Health and Human Services put in place last night through our directed health measures. You may have seen this being talked about at the CDC. They changed their quarantine guidelines. Previously, it was if you had an exposure, such as I had a few weeks ago, you had to quarantine 14 days, which means you couldn't go out, you had to stay home and all that. CDC has updated their guidance to say that you can change that quarantine period by, if you test after 5 days and you test negative, then you can leave quarantine after 7 days, so 7 full days in quarantine. But if you leave quarantine, you have to wear a mask and self-monitor your symptoms so that if you do start developing symptoms, you go back home right away. Or, that's one option. Another option is just to wait 10 days and leave quarantine. But again, you'll still have to, after that 10th day and you leave quarantine, you'll still have to wear a mask and self-monitor to make sure that if you do develop symptoms, you come back. And again, wearing a mask is a part of the conditions of leaving that quarantine early. So please keep that in mind. Again, those new directed health measures are published as of 5 o'clock last night. It is effective. So we do have new rules around quarantining. Next, one of the things that we know with the pandemic is that the hospitality and entertainment industries have been particularly hard hit. We have seen this, for example, for our bars and restaurants. And you may recall that back in March, I issued an executive order that allows bars to be able to do takeout delivery or drive-through beer and liquor as a way to be able to help them when they would not be able to have people coming into the bars. And you may recall that if we go to our red phase up here, that we will go back to implementing that bars will have to go back to takeout, delivery, or drive-through only. So they've been particularly hard hit, and we've tried to address this through things like Takeout Tuesdays, Small Brewery Sundays. Obviously, earlier in the year, the federal government had their Paycheck Protection Program. Here at the state of Nebraska, we actually set aside $20 million specifically for bars and restaurants, as well as the money that we had for small businesses to be able to help get them through this very difficult time. Today we're going to be joined by Jim Engelbart, who is the president of the Nebraska Craft Brewers Association, and he is also the production manager at Empyrean Brewery here in Lincoln. And he is going to talk a little bit about just what else can we do to be able to help support our craft brewers and other businesses in that line of business as they go through this really difficult time, how the pandemic has impacted them, and what we as a public can do to help. And so with that, Jim, I'm going to turn it over to you to talk a little bit about what you've been doing at Empyrean and what the public can do to help you out.
Thanks so much, Governor, and thanks for taking some time to let us come out and speak on behalf of brewers and small businesses all over Nebraska. At Empyrean and Laszlo's Brewery and Grill, being in Lincoln when the virus broke out, we went to curbside dining only, closed our inside dining facilities. And amongst our brewers in the state, we have a mix of us that that operate very similar to restaurants, and some of us that just make beer and serve beer. And so these curbside dining options, are our only outlets for sales. And our main focus really as businesses is we want to stay open and do business, but we very much want to keep our staff safe and employ as long as possible too. So being able to do business via curbside and takeout has been an essential link to all of us as we've gone through different phases of this pandemic. We really hope we don't have to hit red again because, again, it affects not just our businesses, but also bars and restaurants that service us as well. If you didn't know, as a Nebraskan, there's over 52 breweries operating in the state currently, from border to border, from Scottsbluff to McCook, Atkinson, Ohio, Kearney, North Platte, Lincoln, Omaha. Chances are very good you live within 50 miles of a brewery if you live in the state of Nebraska. And as a result of that, you have many options to buy a product we all enjoy that's made very, very close to home. And we appreciate the business during this time especially. Many of us have options to be able to deliver beer directly to your home too. If you call an order, many of us have added online ordering options since the pandemic's broken out as well, so you can order through services. all of us will gladly bring product to our doors to sell you if you come visit us. And this last Sunday, when we celebrated Small Brewery Sunday nationwide in the country, the governor and many of our state senators showed up to visit us and pick up a little product to take home and enjoy. We greatly appreciated that. We'd love it if you'd make every Sunday Small Brewery Sunday.
I like that idea. All right, well, hey, thank you very much, Jim. I appreciate you taking the time for us today and let Nebraskans know that they can get that, in many cases, get the beer delivered to them from your breweries.
Yes, definitely. Call us up on the phone. We have technology and internet access these days too in most places. Options to order, again, like I said, and have a service bring it to your door for you.
All right.
Again, greatly appreciate the opportunity to speak to the governor.
Great. Hey, thanks a lot, Jim. Thanks for joining us.
Cheers.
Every Sunday, Small Brewery Sunday. I like that. All right. Let's see. Next, just a reminder of the upcoming schedule. Monday, Wednesday, Friday at 10 a.m. next week. Right here. Monday, Wednesday, Friday, 10 a.m. Also, we're doing my radio call-in show on Monday at 2 p.m. Central Time. And then we do have a couple of questions. So we got Willis Mahana from West Point News. As of yesterday, Nebraska had 133 fewer COVID patients in hospitals than on November 17th. In the same time period, there have been more than 250 virus-related deaths in the state. Shouldn't deaths be a part of the metric that determines whether stricter DHMs are put in place, as it seems the reason for some but not all hospital beds are being freed up, unfortunately, from people dying? Well, we are focused on the hospital beds because that's what we're trying to provide, is that acute care. So we're focusing our directed health measures on and the restrictions in place based upon that metric. Generally, if you're looking at when people die, that lags behind the hospital measures. What we're really trying to do is make sure that we can provide that acute care for anybody who needs it when they need it. Next, Bill Schammert from 1011 News. As far as vaccine distribution, has thought been given to people who provide spousal or parental care to family members with disabilities and to be included in the priority list along with long-term care facilities? So at this point, again, we've got a limited vaccine supply coming in. We're focusing on people who are healthcare providers who may be exposed to multiple people who have coronavirus. So the individual family member of somebody who might be taking care of someone who's disabled doesn't really fit that category. However, I appreciate the feedback here. We'll take this back to the team for consideration as we think about how we continue to roll out the vaccine across the state and those priorities. So thanks for the feedback on that. And those were the, Taylor, did you get questions text in?
Other questions. Christina from NET says, under Section 1B of the state's vaccine distribution plan, food processing workers are prioritized for vaccine doses. Do you know of any health departments that are preparing to offer priority vaccines to meat packing plant workers, or if the state is in conversation with any to work that out?
So Christine from NET is asking, if you look at the plan that's out there on the Department of Health and Human Services website for the vaccine distribution, in Phase 1B, you've got food processing workers being part of that. And has any local public health department been working on a plan to distribute it to the food processors, or is there anybody working directly with them to be able to do that? Again, that's Phase 1B, so that will be coming later. So to my knowledge, nobody has started working on those plans for that distribution. As we go through Phase 1A, we've still got a lot of people to work through, so we're really focused on that. For example, again, I'm going to caution everybody, we're still waiting to get that emergency use authorization from the FDA, so we don't even have that yet. So once we get that, then we can start working on those Phase 1A people, which are going to include our hospital workers first. And if you look at, say, even with the roughly 100,000 doses we'll get in the month of December that we're forecasted to get, I should say, that will still just really be covering kind of that first group of folks who are hospital workers, long-term care workers. Remember, long-term care residents are also part of that now. So that's an additional 26,000 people there. So even that 100,000 won't cover all that group as we're looking at that. So Phase 1B will come afterwards, but we're still working on Phase 1A.
Mark Balmer with KSMB in Hastings says 4 advocacy groups, including the ACLU, have purchased billboards in Grand Island and Hastings calling for legislation to make packing plants safer. would you support a bill that place stricter safety requirements on packing plants?
So who was that from again?
Mark Balmer,
Mark Baumert from which news outlet?
KSMB.
KSMV asks, there's a number of groups, including the ACLU, have purchased billboards saying that there should be legislation to make food processing plants safer, and would I support such legislation? And I would remind everybody out there that we work very closely with our food processing facilities. UNMC, for example, published their COVID-19 meat processing guide that we used as a best practices document, that we had weekly phone calls with the food processors, and that the responsibility for actually regulating food processors does not lie with the state, it relies with OSHA. That's a federal organization. We were doing this on a non-regulatory basis to be able to make sure we brought that on. And if you look at what we were able to do with food processing, we were successful in reducing the number of cases going there. We addressed things like air handling, masking, screening, and so forth, and we did it all very successfully. So I would not support any legislation with regard to additional regulation on food processing. That's done by the federal government.
Tara with WWT says, how does the state plan to get messaging about the coronavirus vaccine to the Spanish-speaking community? Are there any Hispanic or Latin employees of the state working on effective translations and messaging strategy?
So with regard to Tara WWT is asking about, what about getting the message out to non-English speakers? Particularly, she was asking about the Spanish-speaking community with regard to vaccines. And while I don't have specific plans I can tell you about right now, you can just kind of look back to what we did earlier in the pandemic with regard to our messages around using the tools that we had with regard to masking and washing your hands and so forth. We put out videos, for example, in a number of different languages, including French, English, Karen, Somali, Arabic. So we did a number of different communications out there to be able to reach people with different languages. And so we'll have to do the same thing when it comes to the vaccines. When we get to a stage, we're going to be doing it more broadly.
Our 3Cs have been in Spanish, and I know Josie Rodriguez is always working on these things.
Yep. So we do have a team that is working. So Taylor's just reminding me that the 3C campaign is in Spanish, and Josie Rodriguez works on this, the translation and interpretation of all these things to be able to help us out.
And J. Omar with 1011 says, where do in-home healthcare providers fall in line when it comes to the vaccine? Do they qualify to be vaccinated along with the frontline healthcare workers?
So the question was from J. Omar from 1011, that where do home healthcare providers fall with regard to the vaccine prioritization, and do they fall into that first group of healthcare providers? And Dr. Antone, I don't know that answer off the top of my head.
Phase 1B.
They're in phase 1B, so they'll be in phase 1B.
That's all I got.
All right. Questions? Martha?
You mentioned in passing here that nursing home residents are now part of 1A.
Yes.
When was that change made and why was that change made?
So the question was about long-term residents are now part of phase 1A. When was that change made? I think that change was made yesterday. Is that right, Dr. Antone, or 2 days ago? Late Wednesday. It was made. ACIP recommended that as part of it. And if you think about it, it makes sense from the standpoint we were going to do long-term care staff. And so if you put the staff and residents together, that from just a logistics standpoint may make it easier to get all that done at once. So we're working through that process right now with regard to how that actually gets executed, but those long-term care residents will be in that phase with regard to long-term care staff. Yeah.
Okay, and then I'm interested in this essential caregiver program and how much training these people would need to get and what kind of time commitment they would be expected to make.
So Martha's asking more about the essential caregiver program that we just announced. How much training would people need? How much time commitment would they need to provide? So I'm going to be looking at either Becky or Jennifer to come up and talk about that. Thank you, Becky. If you could help answer Martha's questions just with regard to what are the requirements to be an essential caregiver.
Sure, I'd be happy to, Martha. In the guidelines, we had proposed that folks would be in, essential caregivers would be in a facility for up to 3 hours a day. And what was the rest of your question?
What kind of
Can you-
training will they need?
Oh, the training. So the staff would, or excuse me, the facility and their staff would be responsible for training those individuals to show them how to properly don and doff PPE. And they would not be allowed to move about within the facility. They would be primarily with that resident to, again, to avoid transmission unnecessarily throughout the facility.
So the training would not be on caregiving per se, but more on the PPE.
Martha asked whether the training would be on caregiving or on PPE. The training really isn't on caregiving because the essential caregivers are really just assisting with activities of daily living. So they may come in and help the resident get dressed. They may help them with their hair or brush their teeth, and just be there for conversation. Again, it's that helping them to have a greater quality of life. So the essential caregivers really aren't providing care that the staff of the facility, that the training would be needed, skilled training would be needed for that. This is just to supplement the work.
How do you address any liability issues that might arise from this?
I'm wondering if Jennifer might have more information on that question.
And please remember to repeat the question.
So the question was, how do you address any liability issues that may occur related to the essential caregiving program? And actually what will happen, or I believe what will happen, is that providers who undertake this program will require both the resident and the person coming in to do their essential care to sign a waiver indicating that they understand that they're coming into a building, understand their responsibilities in that building and anything related to that. I'm not sure if that's specific to what you're asking, Andrew. Okay.
And the other thing is, how much was this, I guess, asked for by some of these relatives, and what did they tell you about, this?
Yeah, so this has been something that's been sort of out there, I'm going to say on the national front for a number of months, sort of since the pandemic began. There are providers who are interested in making this available to families, and there are residents who are interested in having their family members come continue to provide this care. And there are also family members who are clearly interested in having more active involvement with, especially if they'd already had active involvement with their family members. And so I think that the biggest issue has been ability to implement during this pandemic related to those things that we talked about earlier, like PPE, like screening, like testing, and some of those things. I think some of those things are addressed in the guidance document that DHHS will be putting out or has put out today. And so I do think there is a request for this and that there is a space for it, in particular for residents and their need for connection.
We have a clarification and a follow-up. Angie
Thank you.
wants people to know that the home health care workers are in phase 1A. They're in the 90,000 healthcare workers we talked about before.
Okay, so Angie Ling, our incident commander for the Department of Health and Human Services, wants to clarify that the home health providers are actually in phase 1A, and they will be part of that 90,000 we were talking about before. Thank you, Taylor. Appreciate that. Thank you, Angie.
And then Kristen Whitman with KPTM wants to know, with Pfizer yesterday announcing it's only going to send half the amount of vaccines previously planned, do we have an updated forecast on the doses Nebraska will get?
So Kristen Whitman from KPTM is asking if, because Pfizer's apparently had some issues with regard to production, have we been told that our forecasts are going to be less? So far, we have not been told that we're going to be any less than what we were originally told. And again, remember, still have to get that FDA emergency use authorization. That is not done yet. So it's all predicated on getting that emergency use authorization first. Andrew.
Clarification also, is the 25,000 you said for the long-term, residents, long-term care residents, that included the 90,000, or was that?
No, so the 90,000 is just the healthcare workers, and then there's another 26,000 residents of long-term care facilities approximately.
clarifying the ACLU, the court case and things like that. As you read this court case, how does that affect how you move forward towards overcrowding, how you move forward towards what your corrections department is doing towards overcrowding?
So the question was with regard to the ACLU lawsuit that they just withdrew. How does that help me? How does that impact my thinking with regard to what we're doing with regard to our corrections system and how we're handling the population there? And it doesn't. I mean, that's the whole point. The reason we beat the ACLU is because we've got a very good attorney general and he's got a great team, and their lawsuit was without basis. So they were trying to make this about a class action lawsuit about overcrowding, but our Department of Corrections had been making a number of steps to address the issues long before the ACLU even launched their lawsuit. And we are going to continue to look to be able to make those improvements. For example, we have asked for and received a large amount, I can't think of the number off the top of my head, but we've received a large amount of investment from the legislature to be able to expand our capacity, and we're continuing to add those facilities on. We've made changes with regard to how we're paying our folks. We've made changes to the security and invested in that. So we've taken a number of steps to improve how we're running our correction system, and that was one of the reasons why the ACLU's lawsuit was unfounded, is because we were already taking those steps to improve, and that's what we're going to continue to do, is look for ways to continue to improve our corrections facilities to be able to serve the people of Nebraska and keep them safe.
Does it change the narrative that your correction system is under crisis?
So Andrew's asking, does it change the narrative that our correction system is under crisis? And I would say that certainly repudiates it, doesn't it? Because the ACLU had threatened this lawsuit for a long time. They finally brought it. It was unfounded, so they had to withdraw it. Certainly we have improvements we have to make in our correction system, and we'll continue to do that. We'll have to continue to make investments, but we are making those, and it was long before the ACLU brought their lawsuit.
And also playing the devil's advocate, so to speak, was that the lawsuit may be premature because it doesn't take into account the pandemic that we're now in, and you have a number of inmates who are coming down with coronavirus as well as staff.
So now Andrew's asking, well, was the lawsuit maybe premature because you've got the pandemic now, and staff and inmates are coming down with the virus, and our Department of Corrections, again, has taken steps to be able to protect what we know is a more at-risk community, right? Congregate living, just like our long-term care facilities. And so they've taken steps to be able to isolate and quarantine people who come down, screening staff and all that sort of stuff. So we are already taking the right steps to be able to help protect our inmates and protect the public safety. And so, again, a lawsuit wouldn't make any difference to that.
And should those inmates be now included inside that 1A as you've done with long-term residents?
And so the question was, should the inmates be included with Phase 1A? And again, generally we were focusing on the healthcare workers who are going to have multiple exposures. And we will, the inmates will be treated just like we generally do, the general public, and that's what we're going to do. So they'll be treated and get being offered the chance to get the vaccine along with the general public.
We have a question from Nicole at NTV. Have you seen a letter written by former Nebraska teachers here asking for a mask mandate? How do you react to seeing that there are educators asking for a statewide mask mandate to help keep schools open?
So the question was, have I seen the letter from the former Nebraska Teacher of the Year and a number of educators asking for a mask mandate? I actually haven't seen the letter. I was made aware that we had that letter, but I have not seen the letter. And how do I react? And I'd say, our schools are taking this, are managing it the way they're supposed to. So we've got 245 school districts. They're not all the same. You've got some very large school districts like Omaha and Lincoln. You've got small school districts. And each school district is putting in their own policies with regard to masking. In fact, I think probably the vast majority of school districts have a policy requiring masking. So they're doing the right things for students to be able to space it out. And here at the state level, we have a directed health measure that requires masking where it's appropriate. When you've got staff and patrons that are going to be closer than 6 feet for more than 15 minutes, which is when an effective use of a mask. So we've got the appropriate strategies both at the school level and the state level with regard to masking.
Do
Martha.
leaves quite a bit yet to deal with before the end of the year. Where are we on that, on distributing that money? Are we gonna have to turn any back?
So Martha is asking, according to the website, Deloitte and Touche that has published with regard to our CARES Act money, about $650 million of the $1.084 billion has been spent. And so where are we with regard to those dollars, and are we going to have to give any back to the federal government? Deloitte is working very feverishly right now to be able to distribute those dollars. You may recall that we had, for example, our second round of many of these programs just completed November 13th, so that was only a little over 2 weeks ago. And so they're processing those applications, and we'll get that money out the door as quickly as possible. And we will not be giving any money back to the federal government. We will be able to use all those dollars before December 30th.
Will there be another round of grants or funding being offered to groups in need?
So the question was, will there be another round of funding or grants to groups in need? And the answer is no, we're not anticipating that. We believe all the dollars are going to be allocated, and again, they'll be all going out the door before the end of the year. Yeah, Andrew.
Did you submit the initial vaccine plan on the distribution? And where will those initial vaccines, what hospitals will get them?
So Andrew's asking, our deadline to get to the White House for that first round of vaccines is due today. Have we submitted that? I don't believe we submitted that. We'll be submitting that later today. So since that plan hasn't been finalized here at the state, I can't comment on which hospitals will be getting it. But you can imagine, again, we're going to be going to hospitals that have the ability to do the ultra-cold storage, because that's what this vaccine is going to require.
Tom Becca says that a Papillion City Councilman claimed that mask mandates are tyranny. Do you agree with that statement?
Tom Beck is asking, he's saying a Papillion City Council member said mask mandates are tyranny, and do I agree with that statement? And no, actually I don't agree with that statement. I think you should use masks where it's appropriate. So for example, with our directed health measure, we're using masks where it's within 6 feet of staff and patrons for 15 minutes or more, and that's when you're most likely to spread the virus. So it's a tool, it's just one of our tools we use to slow down the spread of the virus, and we put together a variety of tools to be able to slow down that spread. That's just one of them. Andrew.
Can you clarify what a general mask mandate from you would be different than what your general health directives are right now regarding masks?
So Andrew's asking, well, what's the difference between what we're doing right now at the state versus a broader mask mandate? And you know what, I guess if people are asking for that universal mask mandate, you probably ought to ask them. We're using masks where it's appropriate. In businesses where you got staff and patrons that are closer than 6 feet for 15 minutes, because that's when you're most likely to spread the virus. So we're following the direction that the CDC puts out, our local public health directors. I think generally everybody agrees if you're closer than 6 feet for 15 minutes, you're likely to spread the virus, and that's when we're asking staff and patrons to wear masks.
So is it just the messaging, that's different, or?
So the question is it just a messaging thing is different? And I guess I would just ask you to go back to the people who are asking for the universal masking, what they think is so different from what we're doing. Martha.
Following up on that, can you explain the difference between what you have in place and what is required, say, in Omaha or in Lincoln?
So what's the difference between what the state is requiring and what's required in Omaha and Lincoln? And probably I'd refer you to the specifics for what the Omaha and Lincoln people are doing, because that was their mandate with regard to masks. I did not have any input in crafting it. I think it's broader from the standpoint of you have to wear a mask whenever you go indoors, and there's a number of exceptions to that. So I would refer you back to Omaha and Lincoln to get the specifics to contrast what we're doing versus what they're doing.
And
Yeah.
There have been some that say we should cancel Christmas. Shouldn't have.
Who's saying we should cancel Christmas, Andrew? I want to know, who's the person saying we should cancel Christmas? Really? Some people are saying we're canceling Christmas? Who? Who's saying that?
We shouldn't,
Who is it? Come on, Andrew, seriously. Who is saying cancel Christmas?
there are some national people who are saying.
Who? Give me a name. Give me a name of somebody who wants to cancel Christmas.
I can't.
Are you sure? Oh, it was a talk show. Okay.
But basically, they said that, we should be kind of this pandemic under a lid.
So Andrew's saying that there's somebody on a talk show said we should shelter in place and cancel Christmas to be able to control the spread of the virus. I'm sure you're gonna find people with all sorts of opinions, and some of them can actually even find their way onto TV. Look, this is a virus. We've been managing it for the last 9 months. We have to continue to manage it. Even with the help of the vaccine that's is on the way, we know that, or at least we're being told, that broad use of the vaccine will not happen until probably April. So for the general public. And it won't start probably until April. So we're gonna have to continue to use all the tools we have, manage this the best way we can with regard to slowing the spread of the virus to preserve our hospital capacity. But we also know that there's other considerations with regard to this, not just the pandemic. So for example, we know that mental health issues are a big thing. The CDC did a study, did a survey of folks, and in that survey, 40% of the people who responded had some mental health issue. 25.5% of those folks who were 18 to 34 responded had a notion or had an ideation of suicide. And that was up significantly from pre-pandemic times. So both those figures were. So we know that there's other costs, healthcare costs that go along with things like a shelter-in-place order. And Christmas is obviously an important holiday. It's a time when people get together. We do need to take appropriate steps and be thoughtful about how we do our family gatherings. But we know there's other healthcare costs that go along with it, like the mental health and the people thinking about suicide. And, you know, the Kim Foundation did a study did a quick survey of the police department, the Omaha Police Department, the Douglas County Sheriff's Office, and the Sarpy County Sheriff's Office. And their numbers are that suicides among people under 20 doubled this year from last year. And by the way, those deaths are 10 times the rate of COVID deaths for that same under 20 age group. So there's other health considerations, and that's why we ought not to cancel Christmas, but we need to think about how we're going to be thoughtful in having our Christmas celebrations. Martha.
Yes, so for Thanksgiving, you urge people to keep it small, not to have the big gatherings. Are you going to offer the same advice for Christmas?
So Martha said, we asked people for Thanksgiving to keep it small. Are we going to offer, tell people the same thing for Christmas? And I think the message is going to be, folks, you need to be thoughtful about how you structure Christmases. Again, we know that this virus spreads from one person to another. So the bigger group that you have, the more likelihood you're going to spread the virus. So if you're planning on get together with, grandma and grandpa, for example, you need to take that in consideration, that if you have a large group of people with grandma and grandpa, you're going to be putting them at greater risk. So we're going to ask people to be thoughtful about their Christmas celebrations, but also understand it's a very important time of year when families get together. All right, any other questions? All right, seeing none, I want to thank, again, Becky Wiesel. Thank you very much, Becky, for talking about essential caregivers. Jennifer, thank you very much for talking about that topic as well, and for helping us out with the collaboration on creating that program. And of course, we want to thank Jim Engelbart from the Nebraska Craft Brewers Association for talking about how we can continue to support our craft brewers. Again, folks, remind you, please continue to follow all the different rules we put out there and use the tools we've given you to be able to slow the spread of the virus. Make sure that when you go out, try and keep that 6 foot of distance. Wash your hands often, 20 seconds at a time. Wear a mask when you go to the store. Go to the store once a week by yourself. Stay home when you're sick. Work from home if you can. These are all things we can do to be able to help slow the spread of the virus and preserve our hospital capacity. Again, we will be back next week, Monday, Wednesday, Friday, 10 a.m. right here in this room, and radio call-in show at 2 p.m. Central Time. So we'll talk to you all next week. Everybody have a good weekend. Thank you, Francis.